Hi, I'm Dr. Hart, and today we're going to be talking about posture. And to do that, to demonstrate that, we're going to do a little bit of an experiment. I've got Rachel here with me today. You all remember Rachel. She's one of our therapists here at Hart Chiropractic Center. So Rachel, I'm going to have you close your eyes. I've got two separate weights, and we're going to have Rachel tell me as far as how much each weight weighs. So Rachel, I've got our first weight here, and I'm going to have you, we're going to hold this up right over here. I'm going to use both hands. Right there, so I'm going to have you hold that weight. You got it? Got that? All right. How much does that weigh?
15 pounds?
15 pounds? All right. We go get the other weight. I'm going to have you put your arms out this way. There it is. Yeah, I'll be right back. I'm going to have you hold this one. How much does that one weigh?
25, 30?
25, 30? Is that one a little bit harder to hold?
A little bit, yes.
All right, now open your eyes. So both weights were the same weight, but this is a 16-pound bowling ball. This is a 16-pound bowling ball, and believe it or not, this is the weight of your head. So the average head weighs about 16 pounds. But what we see is that it feels a lot different depending on where you're holding it. So if you're holding it in here, like we're in a nice, good posture, then there's a lot less stress on your body and on that spine. When the weight is out here, it puts a great deal more stress back here on the back of the neck and the upper back. Thank you, Rachel. That'll read up. So what does that look like? Well, here's one of our patients here, and what we see is that he's got a pretty close to near normal spine, and we see that the spine is nice and healthy. We've got a nice curvature here in the neck, only about an inch. So this line right here represents where the head should fall. So his head's about an inch forward of where what ideal would be, but we don't see ideal very often. But here's where the bowling ball is. Now, in our other patient here, the head is 4 inches forward, and when we look in here, we can see the arthritis developing, and we actually see some of that humping up here. And there's so a great deal more stress, and you see that physically take place as far as structural changes going in here. So what we wanted to talk about today is a little bit of how do we prevent, how do we prevent the neck pain, back pain that develops from poor posture? What are some tricks and tips that you can use? So I've got my friend TJ here who's going to help us with that. TJ, welcome back to the office.
How are you doing, Doc?
Doing good, thank
Good.
you. Thank you for coming in.
Absolutely.
And so we talked last week about maintaining a neutral low back. We're going to put down our bowling ball here. So we talked about the importance of maintaining a neutral low back and how that helps as far as the lower spine. Now we want to look at maintaining a neutral neck as far as so that we're not getting that forward head posture, putting all that stress in here on the spine and causing all those, that strain, that degenerative changes that take place over time from all that extra wear and tear. So TJ, we're going to go through just a couple exercises. So
Absolutely.
One that everybody does is push-ups.
Sweet.
So when you're doing a good push-up, like TJ's got perfect form here, most of us don't do it this way. One of the biggest cheats that we see is the head comes forward and we're straining in here. We've been straining it all day. We're sitting and looking at our phones, at the computers, and now we're gonna work out and we're gonna put even more stress in here. So how do you find a neutral position? Well, one, if you've got an extra set of eyes, like somebody like TJ, who's a trained professional, to make sure that you're doing the exercise appropriate, always best. But if you're at home doing them, then you want to use some tricks. So one way is to arch the back, and then you're going to dip the back down, and then you're going to come back and find the middle. That's your near neutral. So you want to dip it and round it and try to find where the middle of that is to get that good, where the head is in line and we've got a tabletop position. The other thing is that when we're doing the exercise, you want to make sure that you're in a relaxed breathing. So if you're holding your breath, you're working too hard. So you want to breathe through the exercise. So when you do a push-up, you're going to breathe in and breathe out. So kind of things to look for. So if you're holding your breath while you're exercising there, chances are that you're guarding, you're not working in a nice neutral position. Thank you, TJ.
No problem.
So Dr. Hart, here as far as, hopefully that helped as far as looking at maintaining a neutral spine, strengthening that neutral spine so that you can protect that back from neck pain and back pain, helping you stand taller, move better.